What would you say is the biggest change since the last time we spoke?
It's great to be back. Thank you. Yeah, the biggest change is that we've seen a continued jump in the numbers, much worse than when we spoke a few weeks ago.
What do you attribute that to? Is it still community spread? Sort of the idea that once it starts, it's very difficult to stop?
Absolutely. It's a slippery slope. Once it starts, it's difficult to stop, and it's actually spreading like wildfire here in Arizona. Unfortunately, that's why we see such a huge jump, not only in the record number of new cases every day, as well as strain on our hospital system, with our beds being taken up by COVID-19 at a time which is really summer when we usually don't have as much folks in the hospital. We really look more in our hospital system like the height of cold and flu season.
Right. And so tell us about that capacity. What are you facing? Are you going to have enough beds? And are any further closures in that area or that state you think going to be likely?
Well, I definitely think that it's unpredictable in terms of where we go from here because the numbers are continuing to rise and the beds are beginning to disappear. And so we don't know if we're going to have enough beds. We're activating surge capacity. We're trying to expand. All of my colleagues among all the health hospital systems are noticing the trend in the wrong direction, having to take care of folks. You know, the problem is that people think, well, do we have enough healthcare capacity for COVID? But that's not the issue. We still have the chronic diseases that people have. We have people with diabetes, people getting heart attacks, strokes, people with cancer, all sorts of other reasons to go in the hospital. And if the beds are taken up with COVID-19, there won't be any room for us to be able to take care of you with your chronic disease. And so people may not die from the coronavirus, but you'll die from other things.
Doctor, I'm curious. I'm going to ask you one of my famous compound questions, and the first one is very simple, probably a one-word answer. Have we bent the curve? But the second question is more nuanced, and that is, you know, there are a lot of reasons given for why cases seem to be rising in states like Arizona. What do you put your finger on? Is it, as we mentioned in the previous segment, people not paying attention to social distancing, people not wearing masks? Is that the most important thing you can do? Is it the fact that there may have been demonstrations where people shared space a little too closely? What do you think? So, number one, have we bent the curve? Number two, why the spike?
We have not bent the curve. The answer is no to that because we're seeing a jump. We continue to see a rise. The reason for it is, I think, all the reasons you mentioned. It's really people not socially distancing, not wearing face coverings. So any setting, whether it's in bars, nightclubs, or being close in the setting of the protests, obviously the protests a little bit better being outdoors, but being indoors is the worst with closed ventilation systems and not wearing masks and not physically distancing. So all of those combined together, I think, have put us where we are right now. And so we really need to take action. And I'm afraid that just wearing masks alone won't do it. We're really going to have to reevaluate the different phases of reopening. We're going to have to look at what venues make sense to stay open. I think we have to look at other states like Texas closing down bars, Florida stopping alcohol sales in bars because they've identified, I think the governor of Texas noted that bars are where folks congregate, and I think that's the same case in Arizona. So we really have to reevaluate what's open and what's closed in order to save lives.